Hello everybody, this is Dr. Shifa, and if you're wondering what I'm doing now, we've been trying to sort out some back-end technical corrections. So today I'm here doing a live on behalf of Medela India. The reason I'm doing this live is on the celebration of the World Breastfeeding Week 2020, and it's a week-long celebration worldwide, and this is all about breastfeeding, and I'm doing this live on the topic called breastfeeding, the elixir for healthy sleep and straight teeth for Medela India. So a little bit about me. Those of you who are here on my page know that I am Dr. Shifa. I am a preventive pediatric dentist with special focus on pediatric sleep and tongue ties especially. Those of you who are in Medela page who are seeing me now, you could all be wondering, it's breastfeeding week and what is that a dentist is doing? Most importantly, what would have happened in your aspects for those of your new mothers who have not had experience, dentists are predominantly teeth related. For the mothers who've had experience with dentists, you would have heard that you should stop breastfeeding after a certain age so that the child won't get cavities. So I'm today going to take you through a world of prevention on how you can breastfeed to get straight teeth naturally and a healthy sleep. So breastfeeding being the elixir for helping children have straight teeth and healthy sleep. So a little bit about me. I finished my bachelor's in dental surgery. I finished my master's in preventive pediatric and preventive dentistry, and after that since 2013 my focus shifted to orofacial myofunctional therapy. Now with orofacial myofunctional therapy, it is head and neck exercises, and I predominantly went to learn this head and neck exercises so children can get straight teeth naturally, and I got myself certified from the Myofunctional Research Co in Australia, but then after I started helping children get straight teeth naturally, it was a world of change that I've been seeing, that some children can get straight teeth naturally, some children have difficulties in establishing these exercises. So what is this has led me to questions, and like a puzzle, like a maze today, my practice predominantly revolves around breastfeeding, because breastfeeding is the elixir to get straight teeth. Now as I'm talking on and off, I'll be shifting my camera towards the screen, so when I want you all to be watching certain images, it'll help us all understand. So now here in the screen, what you're seeing is a study that is published wherein in prehistoric humans, we rarely had issues with crooked teeth. So prehistoric humans predominantly had wider jaws, and then they did not have narrow teeth, and they had wider airways. So if you look at they had wider airways. So if you look at one thing that is very common with prehistoric humans, 1 minute, sorry for some technical glitches I have here. So prehistoric humans were predominantly breastfed. For those of you here, you know that grandmoms have usually breastfeed children that is newborn, as well as children that are 6-7 years in the same family. So what is the difference here that has happened is industrialization. So when there was industrialization, and especially breastfeeding became less uncommon, we started developing a lot of lifestyle induced diseases. One of the major lifestyle induced disease is crooked teeth. And when these crooked teeth are happening, what was the major reason that caused this? That's when I want to take you through this image that we're seeing here. One of the major part in making the jaw U-shape, one of the major role of the tongue here is to make the jaws U-shape and have straight teeth. So if you look at the tongue, when the tongue is functioning optimally and it goes to the upper jaw, it gets straight, it helps in developing wider jaws and get rid of crooked teeth. What is one main function that helps the tongue go up? It's breastfeeding. If you see in this video, breastfeeding is a process that naturally helps children to push the tongue up the jaw. So they help the children to get the jaw up. Yeah, so for you to have a wider jaw with U-shaped arch and with straight teeth naturally, one of the major part here is by the tongue. So when there is a jaw and when your tongue goes up the jaw, it helps to make the arch U-shape. Now tongue plays a major role in making the arch U-shape, and one of the major function exercise the child can do in getting this tongue up there is breastfeeding. They help the tongue to go really up the jaw, and I would say like an architect, it helps to scaffold. It's like a scaffold which actually helps the jaw to become U-shaped. So now those of you who are interested here who wants children to have naturally wider jaws, now one of the major reason how these children can get is with the tongue going up. And you saw in the video that how does the tongue go up? Predominantly it's because of breastfeeding. So this process of breastfeeding pushes the tongue up there. So this is an image that shows that the tongue is actually pushed up and it helps in breastfeeding. But what happens when the child is bottle fed? It pushes the tongue down and backward. So what happens predominantly with bottle fed children is the tongue, instead of going up the jaw, is pushed down and backward. So when the tongue is pushed down and backward, its ability to make the arch form, that is its ability to make the upper arch U-shaped, is not happening, or the upper arch tends to crumble a little. Now with this breastfeeding being one of the major reasons where the tongue goes up, it's always recommended that the mother breastfeeds exclusively the child up till 6 months of age, and from there on minimum till 2 years along with the other food. So I've been talking about the position of tongue and how it helps in going up the jaw. Now what is this has to do with sleep? Now the upper jaw is the roof of the mouth, but one thing the upper jaw is you'll also have to remember is the upper jaw is the floor of the nose as well. So when the upper jaw is wider and U-shaped, one thing we have is straight teeth and naturally aligned teeth. But what also happens is when the upper jaw is wider, there's enough nasal space so children can breathe healthily. But when the upper jaw is narrow and it's comb shaped, or it's dome shaped, it also interferes with the ability to breathe through the mouth. So it interferes the children's nasal capacity. So when we have a wider jaw, there's enough nasal space to breathe, but when the jaws are narrow and when the jaws are up, there's a chance that it increases the chance of the nasal space to narrow down. So what happens, what we see as crooked teeth is just tip of the iceberg. These children who have crooked teeth also have difficulties in establishing the breathing through the nose. Now we all know that nose is